been fighting this fight for years now, and Healthscope just won't relent.
Who needs to listen? Anna! When should he listen? Now!
So the reason that we were going to strike today was because of the lack of information that Healthscope has given us. Just at the last minute, I believe they agreed to discuss that with the union.
We're now at the pointy end of business where the resources have to be transferred to the new hospital, and quite frankly the discussions that have been going on over those few years have resulted in a situation where some people haven't been offered jobs, other people have been offered jobs that are not appropriate to their skills.
Your motion required them to commit to participate in meetings and negotiations on these matters. So congratulations for you putting your jobs on the line to protect your jobs.
It's really sad that strike action has to be threatened before you can get any meaningful discussions. And in the last 48 hours we have had meaningful discussions, but we've still only got broad agreement to our asks, and we need to have ironclad commitment.
They've given us an in-principle agreement. They're going to tell us some configurations of the ward. They've given us a guaranteed 80-20, 80 registered nurses, 20% ENs, AINs in all the regular wards, so that's a huge step forward.
You've now proved that when you stand together, you can achieve what you thought was impossible. Now what we have to do is make sure that everything they've committed to actually comes to pass. We need them to be able to give you the staff, the ratios, the skill mix, everything that you need, not to mention not counting babies.
I'm hoping for some more information and that they commit to the ratios that are really important. One of the main ones I would really like them to commit to is one-on-one care for women in labour.
We were told that everybody would be able to move to Healthscope and everybody would be given a job. That is not the case.
It was decided that only 9 of the 25 staff would be offered positions in the intensive care unit in the new hospital. That has been absolutely devastating to our unit.
Things like diabetes educators, clinical nurse consultants aren't getting positions. The support services, so drug and alcohol, diabetes educator, dementia and deliria, pain, wound assessment, none of those positions are going across.
There's a few of us in maternity who haven't been offered a job yet. We're still waiting. It's a bit nerve-wracking with mortgages and families, and so hoping to hear soon.
We will continue this battle right up until October the 30th.
And I'm sincerely hoping that holding the employers' feet to the fire will be able to ensure that Healthscope is the good employer we know they can be.